Good morning, students. Today we will discuss the seventh cranial nerve, that is facial nerve. Now, this facial nerve, so the important points are in the introduction of this nerve is that this nerve is the nerve of second branchial arch. So, all the muscles which are developing from the mesoderm of the second branchial arch, they are supplied by the facial nerve. Secondly, this nerve is a mixed nerve. It has both the motor and sensory component. So the sensory component of this nerve is given the name nervus intermedius. So the another name of this nerve, the sensory part of the facial nerve is nervus intermedius. So why this word intermedius is there? Because when these two roots of the facial nerve, they leave through a gap between pons and medulla. So this nervus intermedius is lying between the motor portion of the facial nerve and the eighth cranial nerve, that is the vestibulocochlear nerve. So that's why it is lying in between these two component of nerve. One component is of facial and another component is of vestibulocochlear nerve. This sensory root is given the name nervus intermedius. So once these two roots they leave, they join to form a single trunk, and this trunk it moves towards the internal acoustic meatus. So once it is going towards the internal acoustic meatus, it enters into the petrous part of the temporal bone, where they show a bend, they show a elevation, which is known as the geniculate ganglion. So this is the geniculate ganglion. Now this geniculate ganglion is basically is having the unipolar neurons. The central processes of that geniculate ganglion, they form the sensory root. Now this sensory root is carrying the fibers from the anterior to third portion of the tongue. Then it is carrying the basically giving parasympathetic supply to the submandibular, sublingual and lacrimal gland. Now, once it is passing through the petrous part of the temporal bone, it leaves the cranium through the stylomastoid foramen. Now, once it is leaving the stylomastoid foramen and come out of the cranium, it enters into the parotid gland. So, while traversing through the parotid gland, at the anterior border of the parotid gland, this nerve it emerges as the by the number of branches. So that we will discuss. So this is the course of this nerve, starting from the brain and ending on the face. So starting from the brain means it is just nuclei of this nerve, they are lying in the lower part of the pons, and the leaving point of this nerve is between groove between pons and medulla, then move toward the internal acoustic meatus, then traverse the petrous part of the temporal bone. It leave the cranium through stylomastoid foramen, enter the parotid gland, and within the parotid gland at the anterior border it gives number of branches which are given on the face to supply the muscles of face. Now, what are the different nuclei which are related with this nerve? So that is important. So second important point linked with this nerve is that various nuclei. So what are the various nuclei which are related with this nerve? One is the motor nucleus. Now this motor nucleus is going to supply the basically sending the fibers to the muscles of the face. Now the upper half of the face is getting supply from both the cerebral cortex. So it means it has double supply. It is receiving the this half of the upper portion is receiving the fibers from this side as well as from the opposite side. But in the lower half of the face, the muscles in the suppose on the left side is receiving the fibers from the right side. So they have a supply from the single cerebral hemisphere, but that is of opposite side. Next nucleus which are related with the facial nerve is parasympathetic nucleus. So there are two parasympathetic nucleus are there. That is superior salivatory nucleus and lacrymatory nucleus. So these are the two nuclei which are related with this nerve. This superior salivatory nucleus is going to give fibers to the submandibular and sublingual gland, and this lacrymatory nucleus is going to give fibers to the lacrimal gland. Then third nucleus which is related with this nerve is nucleus of tractus solitarius. Nucleus of tractus solitarius. Now this nucleus of tractus solitarius is basically is the sensory nucleus. So there are three nuclei which are related with this nerve: motor nucleus, parasympathetic, and sensory nucleus. Now this sensory nucleus is nothing, that is the nucleus of tractus solitarius, which is receiving the fibers of taste from the anterior two-third portion of the tongue. So these are the nuclei. Now coming to the different branches of this facial nerve. So next part related with any nerve is its branches. So first branch which is arising from this nerve is the greater petrosal nerve. So this is greater petrosal nerve. So this is one. Then it is going to give a branched nerve to stapedius. Nerve to stapedius. Then 6 millimeter above the stylomastoid foramen, it gives the chorda tympani branch. So second is the nerve to stapedius. Third is the nerve to, that is chorda tympani nerve. So once it is leaving through the stylomastoid foramen, it gives one branch, that is the posterior auricular. Posterior auricular nerve. So this is the fourth branch which is arising from this, but outside of the cranium. Now this posterior auricular nerve, it divides into two divisions, you can see, into auricular branch and occipital branch. Now this auricular branch is going to supply the auricular muscles, and occipital branch is going to supply the occipital belly of the occipitofrontalis muscle. So this is regarding the posterior auricular nerve. Then next branch which is given by this is nerve to posterior belly of digastric. So that is the next branch which is arising from this, that is number 5. Then is this is nerve to styloid. So sixth branch is nerve to styloid. So this nerve to styloid and nerve to posterior belly of digastric, these branches are going to give the supply to the muscles with same name, that is to posterior belly of digastric and to the styloid muscle. And posterior auricular is going to supply the auricular muscle and the occipital belly of occipitofrontalis muscle. This nerve to stapedius is going to supply the stapedius muscle. Now this chorda tympani is basically taking the fibers of taste from the anterior two-third portion of the tongue. Now once it is just giving branch nerve to styloid, this branch it enters, or this nerve it enters into the parotid gland. Now once it is entering the parotid gland, it gives number of branches. One is temporal. Now this temporal branch is going to supply the frontal belly of occipitofrontalis muscle. Clear? And this occipital branch of the posterior auricular is going to supply the occipital belly of occipitofrontalis muscle. Then it is going to supply the corrugator supercilii muscle in this region. The next branch which is given by this is, so this is number 7. Now this branch is given the name zygomatic nerve. Now this zygomatic nerve is going to give supply to the orbicularis oculi muscle. Now next is the buccal branch. So this is buccal branch, and this buccal branch is dividing into upper buccal and lower buccal. Now upper buccal is going to supply the zygomaticus major and minor muscle and muscles of the upper lip, that is levator labii superioris. And this lower buccal is going to supply the buccinator muscle as well as to the muscles of the lower lip. Now this next branch which is given by this is marginal mandibular. Now this marginal mandibular is going to supply the muscles in this region, that is of the chin portion. Then there is cervical branch. 11th number is cervical branch, which is going to supply the platysma muscle. So these are the branches given by the facial nerve. So I repeat, the first branch arising from the facial nerve is greater petrosal nerve, that I will discuss with some pathway. Then next branch is nerve to stapedius, then chorda tympani. Then after leaving the stylomastoid, it gives posterior auricular, which divide into occipital and auricular branch. This occipital branch is going to supply the occipital belly of occipitofrontalis muscle, and this auricular branch is going to supply the muscles of the auricle. Now, after that, it gives nerve to posterior belly of digastric, then nerve to stylohyoid. Then it enters the parotid and leave the parotid at the anterior border to give number of branches, that is temporal, zygomatic, upper buccal, lower buccal, marginal mandibular and cervical. So these are the branches arising from the facial nerve. Now coming to the functional component of this nerve, if we discuss the functional component, so from this, as I have told you, that different supplies which are given by this nerve, accordingly we will discuss the functional component. So first functional component is special visceral efferent. So I told you this is the nerve of the second branchial arch. So the muscles arising from the second branchial arch, they are supplied by the facial nerve. The next component is the general visceral efferent. General visceral efferent is basically the supply to the submandibular and sublingual gland. So that is general visceral efferent. Then comes the special visceral afferent. So this component is basically carrying the fibers from the anterior two-third portion of the tongue, and that those fibers are taken up by the chorda tympani through the sensory route to the higher center, to which nucleus? That is nucleus of tractus solitarius. So that is the another component. Then there is you can say general somatic afferent. So I told you that the external auditory meatus is getting the general sensations, and those sensations are taken up by the this facial nerve, but these fibers are reaching to the spinal nucleus of trigeminal. So these are the four functional components which are related with this nerve. So I repeat, special visceral efferent is always concerned with branchial arches. Special visceral efferent, muscles arising from the branchial arches. So facial nerve is the nerve of second branchial arch. So the muscles supplied by are supplied, which are developing from that arch, they are supplied by the facial nerve. General visceral efferent, that is basically parasympathetic fibers arising from the parasympathetic nucleus. What are those nucleus? That is superior salivatory, nucleus, and lacrimatory nucleus. So these are superior salivatory is concerned with this general visceral efferent. Then special visceral efferent is the fibers arising from the anterior two-third portion of the tongue to supply the or taking the fibers of the taste to the higher center. And then is general somatic efferent. These fibers are ending to the spinal nucleus of trigeminal. So this is all about the nerve. So I discussed the nerve under the heading course, general introduction and course, then the branches of this nerve, and then the functional component. Now in next part I will discuss what are the important pathways. We have discussed the various nucleus, and these nuclei, how they are going to supply the various glands, and how it is taking the fibers or sensory fibers to the higher center. So I will draw one diagram. So this is the sensory root, this is the motor root, this is the geniculate ganglion. So this is like this. Now from the geniculate ganglion, I told you the first branch arising is the greater petrosal nerve. Now this greater petrosal nerve, it joined the deep petrosal nerve to form the nerve of pterygoid canal. So this nerve of pterygoid canal is basically, I will tell you how, is related with the pterygopalatine ganglion. Pterygopalatine ganglion. Now this pterygopalatine ganglion is just hanging with the maxillary nerve. Now this maxillary nerve has one branch, that is zygomatic nerve. Which has two divisions, zygomaticofacial and zygomaticotemporal. This is zygomaticotemporal. Now this zygomaticotemporal has communication with the lacrimal nerve. Now this lacrimal nerve is going to supply the lacrimal gland. So what is the pathway then? The fibers, they start from the lacrimatory nucleus. Which is situated in the lower part of the pons. The fibers, they enter the sensory root. They enter the greater petrosal nerve. They enter the nerve of pterygoid canal. They reach the pterygopalatine ganglion. Clear? From this pterygopalatine ganglion, they enter the one of the ganglionic branch of this maxillary nerve. Enter the maxillary nerve. And from this maxillary nerve, they enter the one branch of the maxillary nerve, that is zygomatic nerve. Now from this zygomatic nerve, the fibers, they enter the zygomaticotemporal nerve. And from this zygomaticotemporal nerve, they, through communicating branch, they just enter the lacrimal nerve to supply the lacrimal gland. So this is one pathway. So for the lacrimal gland. Now another pathway is as I have told you, in the branches of the facial nerve, there is one branch, that is chorda tympani. So this is the stylomastoid foramen. Before that, there is chorda tympani, which has basically communication with the lingual nerve. Now, the fibers of taste from the anterior two-third portion of the tongue, clear, they just pass through this lingual nerve. Through this lingual nerve, the fibers, they enter the chorda tympani. From this chorda tympani, the fibers, they enter the facial nerve. From this facial nerve, the fibers, they enter the sensory root and they go to the higher center, that is the nucleus of tractus solitarius. So this is the pathway of taste, how the fibers from the anterior two-third portion of the tongue. So this is tongue. The fibers, they go through the lacrimal nerve. So this is lacrimal nerve. Which is this nerve? This is chorda tympani. So initially the fibers, they enter the lingual nerve, which has communication with this chorda tympani. The fibers, they enter the chorda tympani. And from this chorda tympani, the fibers enter the main facial nerve, reaches here, then they go to the nucleus of tractus solitarius. So basically, these are the peripheral processes of that unipolar neuron, and from here the central processes. From this portion, the central processes, they reach the nucleus of tractus solitarius. So this is the taste pathway. Now coming to the from the superior salivatory nucleus. So here the superior salivatory nucleus is there. So superior salivatory nucleus. The fibers, they enter the sensory part of this nerve. Sorry. They enter the chorda tympani. From this chorda tympani, the fibers, they enter the lingual nerve. Through the one ganglionic branch, they enter the submandibular gland. Submandibular gland. And after supplying this submandibular glands, few fibers, they re-enter the lingual nerve. Clear? And they just enter the lingual nerve to supply the sublingual gland. So these are the important supplies concerned with the facial nerve. So it is going to supply the lacrimal gland. The fibers are coming from lacrimal nucleus. It is going to supply the sublingual and submandibular gland. The fibers are coming from the superior salivatory nucleus. But the pathway is same. But they are leaving the chorda tympani. They pass through lingual nerve and going to supply it. And after the relay in this portion, that is submandibular ganglion, before that one ganglion is there. So after the relay from this ganglion, the fibers are supplied to this submandibular gland. So this is submandibular ganglion. Clear? So these post-ganglionic fibers, they re-enter the ganglionic branch and to supply the sublingual gland. So up to these are the pre-ganglionic fibers. So once the relay happened here, these are called as the post-ganglionic fibers. So same thing is happening here. So up to this, the fibers are known as pre-ganglionic fibers. So once the relay is happening here, these are known as the post-ganglionic fibers. For the sensory, that is taste fibers coming from the tongue, the fiber are reaching here. They are basically here, the unipolar neuron is there. So axons of that is known as the fibers which are receiving the fibers from the tongue, but the post of fibers are, that is, central processes of that neuron are reaching to the nucleus of tractus solitarius. So these pathways are very important while describing the facial nerve. So thank you very much. If you like my channel, so I request you again to kindly subscribe it, share it, and like it. Thank you very much.